honored to be part of this distinguished panel here this evening. Miria, Lois, of course, Gloria Steinem and Jane. You can hear me? Okay. And I'd also like to thank Jane and Amy Arias for organizing this panel this evening. There are lots of things. One thing I must say about Gloria Steinem is that our students, undergraduates and graduate students, cut their teeth on Gloria Steinem readings. And I know for the undergraduate students in intro, her article on if men could menstruate and outrageous acts, those are very, very popular with our students, both men and women. And we have very lively discussions when we do that. There are a number of issues that are facing women with these coming elections, and in different ways we're hearing about some of these concerns. And I know definitely the economy, the wage gap, gender, equal pay for equal work, political representation, reproductive rights. And I thought I'd like to address two of these issues from a global perspective. Focusing on Africa, because I'm more familiar with that. I've just come back and I've been part of some of the activism that's been going on in Sierra Leone. Now, certainly, in Africa since the 1990s, remarkable changes have been taking place in terms of the rise of women as political leaders, and new constitutional and legislative reforms have been instituted in many African countries as a result of women's political activism. So I want to discuss how some of the challenges women face here in the United States are being addressed in that region of the world. What are the implications for the outcome of this election that we are going to vote in, and how is that going to affect women in the global south? You may be wondering, well, why would we want to talk about that? And what we might be able to learn also from the activism of African women in terms of how they're lobbying their governments to initiate policy changes that will improve the status and rights of women. The two issues I want to focus on, and if I'm running out of time, I'll just focus on one, but are women's health and reproductive rights and political representation of women. Now, in terms of women's health and reproductive rights, the National Organization for Women Now says that when we talk about reproductive rights, this isn't simply a matter of choice, but it's a matter of life and death. And access to a safe and legal abortion, effective birth control, emergency contraception, access to reproductive health services, education for all women, all of these are matters of life and death, and they affect women's lives in so many ways. Some see this as a human right, while others see it as a constitutional right of women to oppose attempts to restrict these fundamental rights through legislation, regulation, constitutional amendments. Now, how do our concerns here about reproductive rights in the United States interconnect with those of our sisters in Africa? Abortion is responsible for half of maternal deaths in Africa and remains illegal in most African countries. A 2004 study by the World Health Organization calculated that 1 out of every 4 deaths related to pregnancy in the world was due to unsafe practices in abortion, and that 50% of maternal deaths in sub-Saharan Africa are due to unsafe abortions. Low contraceptive use is another factor strongly associated with high risk of dying from complications in pregnancy in Africa. Teenage pregnancy and the risks associated with unsafe abortion is also a critical issue. And for teenage pregnancy, people say, oh, well, they're just being promiscuous. But a lot of time it has to do with the result of rape, incest, sexual abuse, gender-based violence, early marriage, sex work, which teenage girls engage in to survive, and also to gain economic autonomy, resulting from them having to leave school very early. So what does this have to do with us? Well, for us here in the United States, what we have to remember is the global gag rule policy. I don't know if you're familiar with that. It was also called the Mexico City policy, which was passed by President Reagan in 1985. and was enforced by both the Bush administrations. And this policy denies US funding to family planning and population assistance programs in the Global South if they provide abortions, and or if they refer patients to abortion services elsewhere, even when that is done with non-US funds. This policy resulted in the closure of clinics and led to likely injury and death of thousands of African women, and other parts of the world too, it's not just Africa. But the gag rule was repealed by President Obama in 2009, and we're hoping so we see how we are interconnected. As a world leader, the United States cannot reinstate these restrictive abortion laws and must make family planning and other reproductive health services like contraception affordable and easily accessible. And also the Millennium UN Development Goals, which aims to significantly reduce world poverty by 2015, includes the goal of reducing maternal mortality and improving maternal health. And the US has to be a leader in this effort because it is linked to economic security on a global scale. So one of the ways in which African women activists have advocated for changes in their country's policy towards reproductive rights and maternal health is by establishing coalitions with international women's movements, UN agencies, grassroots organizing, market women, women farmers, traditional healers, traditional political leaders, professional women. They all come together to work on particular issues that are of interest to them, and then everybody goes their own way and they come back. But they all have each other's backs. And also they work regionally to pressure governments to deliver on promises that their governments made when they became signatories to UN treaties like the Convention for the Elimination of All Forms of Discrimination Against Women, which, by the way, the United States is not a signatory to, or the African Charter on Human Rights. So two noted examples I just want to touch on are Sierra Leone's Healthcare Act, which was passed in 2011, which provides every pregnant woman, breastfeeding mother, and children under 5 years of age free health care in any government facility, from prenatal checkups, surgical services, drugs, vaccinations, inpatient hospital care, everything. Now, there are many factors, definitely, besides that, which were not addressed. Unsafe abortions, early marriage, sex and reproductive education, female genital cutting. Those issues were not addressed. But I think, at least up to this point, it was a significant development in provision of healthcare services to women. But an even more progressive step was taken by the Rwandan government to respect women's fundamental reproductive and human rights. And what they did was they expanded the grounds on which abortion is legally permitted by signing into law a new penal code reducing harsh criminal penalties against women who terminate their pregnancies and doctors who perform abortions. That's in Rwanda, which went through a long civil war. Women who became pregnant as a result of rape, incest, or forced marriage, or whose pregnancy endangers their health, are now legally entitled to safe abortion services in Rwanda. That's in Africa. The point I want to make is about greater political representation of African women. African women's movements, like their counterparts in other parts of the world, including the United States, are working really hard to figure out how can they best work with their governments to advance their concerns. And many of these governments, even though they're democratic, are very authoritarian, militaristic, very patriarchal in culture. But women activists, again, have relied on United Nations efforts to create national machineries to advance and monitor women's concerns and international treaties, because they know these governments are going to respond to UN treaties and conventions they've signed, otherwise they're not going to get aid. So, and other sources. So that's one thing that they're using. And so the good news, for example, is that Rwanda has the highest number of women in parliament, with close to 49% of its seats held by women. According to Eileen Marie Tripp in her book African Women's Movements, women hold over 1/3 of parliamentary seats in Africa. African governments have made significant advancements in establishing national machineries to advance women's status. There are now 36 ministries of gender in African countries, which is over 70% of countries in the region. Some countries have in place trying to establish gender equality agendas, mainstreaming gender into macroeconomic policy, revising constitutions and laws, enacting gender equality legislation. In fact, I was part of that in Sierra Leone. Unfortunately, it didn't go through, but I don't think the women are going to give up on that. But they definitely did pass a Sexual Offences Act recently, and in 2007, a Domestic Violence Act. Some women's movements feel that some of these initiatives are ghettoizing women's concerns. And so, like Ghana and South Africa, they are fighting for a constitutional guarantee on women's rights that would empower the national machinery, but also establish an independent statutory board that would work across ministries and create greater accountability and build a sense of activism in the ministry. So one other thing is that many African women's movements are now demanding 50% representation in elected office as well as other decision-making positions in Africa. Leading advocates of these 50-50 campaigns, I'm proud to say Sierra Leone is one, South Africa, Tanzania, Senegal, Kenya, Malawi, Uganda. And what they do, like Emily's List, they train women, they train and teach them how to raise funds, accomplish their goals. They also train the media to be gender sensitive in reporting about women's concerns. And again, the way they've done this is, I know that's a very problematic, controversial issue here in America, but they're advocating to adopt quotas and similar mechanisms to advance women's representation. For them, quotas are designed to be temporary measures to create gender balance. And about 28 countries in the continent practice some form of quotas. And so I think I'm just going to end up there because basically new norms relating to women's political representation are being advocated within the United Nations, regional organizations like the Africa Union, ECOWAS, and all of this has helped African women demand increased representation in the political process. And this in turn has pushed their government to advance women's status at the national level. So today we have 2 women heads of state in Africa, Ellen Johnson Sirleaf in Liberia and the new president of Malawi. And so, although all of their efforts have not been very successful, new trends are being set, new opportunities are established for women to pressure their governments to advance women's rights and create a more enabling environment for change. Nice.